Eastern State Hospital is the second oldest state psychiatric hospital in the United States. Since 1824, when it first opened as the Kentucky Lunatic Asylum, it has reflected the evolving practice of care for the mentally ill. During the mid-1800s, the hospital developed moral therapy programs which emphasized kindness and respect for the patients. In the years following the Civil War, Eastern State Hospital, as well as other psychiatric hospitals, experienced problems of overcrowding and custodial care, and massive institutions were built throughout the country. By the 1940s, there were as many as 2,000 patients at Eastern State Hospital. With the development of antipsychotic medications in the mid-1950s, the rise of the community mental health program in the late 1960s, and our emphasis on deinstitutionalization, the patient population has been dramatically reduced. The hospital now serves a daily population of about 240 people, whose average length of stay is 28 days on the intensive treatment service. Throughout its long and rich history, Eastern State Hospital has progressed from being the primary source of mental health care for the area west of the Allegheny Mountains to its present status as an accredited treatment center for 75 counties in the eastern half of the Commonwealth of Kentucky. Confidentiality and the patient's right to privacy are important legal considerations. Therefore, most of the people whom you will see in the slides are hospital staff who volunteered their time for this presentation. Some slides show an actual patient who gave us permission to photograph. The ultimate responsibility for all major decisions affecting the operation of the hospital lies with the hospital director. The director oversees the operation of both the clinical and administrative areas and is the main communication link between this hospital and other agencies. Administrative areas of the hospital consist of departments which provide indirect patient care. These support services are essential to the daily operation of the entire hospital. One such service is the personnel department. It is responsible for all record-keeping activities necessary to maintain a staff of approximately 500 employees. As in any large organization, a considerable amount of information must be processed, and much of ours is done by the medical records department. This department maintains a confidential folder on each patient, which serves as a source of information for the staff and aids in protecting the legal rights of the patients. The business office is responsible for the hospital's budgetary matters, as well as acting as a bank, where patients may deposit or withdraw their own money. Workers in this office assist patients in exploring financial resources to help pay the cost of their hospitalization. The business office also purchases equipment and supplies for the hospital. A well-trained maintenance crew is provided by the engineering department to take care of carpentry, painting, maintenance, and engineering. Our grounds crew is responsible for maintaining the 88 acres on which the hospital is located. Environmental Services maintains the overall cleanliness of the hospital. Each employee is responsible for helping to provide a sanitary environment for the benefit of patients, staff, and visitors. Laundry services are the responsibility of the clothing department. Clothing clerks check each patient area daily to assure that adequate clothing is available. Dietetics is responsible for all patient meals, with consideration for the special dietary needs of many of the patients. Food is prepared in the main kitchen and served in Kennedy Hall or in one of our smaller dining areas. Snacks are also made available in the evenings. The transportation department is responsible for transporting patients within the hospital to other hospitals and treatment facilities and to their local comprehensive care center at the time of discharge. The communication department provides 24-hour phone coverage and a receptionist to greet visitors and to issue visitor permits. Another important part of our communication system is the mailroom, which is open Monday through Friday and enables patients to send and to receive mail on the ward. Security officers are on duty 24 hours a day to screen incoming traffic for the protection of patients and property. The patient's beauty shop provides services on a regularly scheduled basis. The volunteer department's function is to recruit and train volunteers to complement the programs for patients at the hospital. There are many different opportunities for individual and group volunteers. Located in this area are a patient library, music room, adult education classroom, and the volunteer shop, where patients may select free personal items. The clinical areas of the hospital consist of departments involved in direct patient care. These include the medical staff, which consists of physicians, psychiatrists, dentists, and other medical consultants. Other clinical departments are social work services, nursing, psychology, chaplain services, and parapsychiatric services, which consist of recreational, music, physical, and occupational therapies, the Work Activity Center, and the STEP Workshop. This is the intensive treatment service where most newly admitted patients are treated. This service emphasizes intensive short-term therapy with a quick return to the community. The Learning and Habilitation Service provides programming and treatment for patients with severe behavioral problems and developmental disabilities. Through a contract with the Bluegrass Association for Retarded Citizens, most of the residents on this service are able to leave the hospital each day to attend the Community Adjustment Program on Georgetown Street in Lexington. The purpose of this service is to provide a teaching training atmosphere for patients who do not have the basic skills necessary for more independent functioning in the community. The goals of the program are to decrease behaviors which keep the individual out of the community and to increase each individual's independent functioning to maximum potential. Here they learn basic self-care, behavioral skills, and social skills that enable them to reach their potentials. Metro Industrial Services Workshop then employs those patients who are ready to work in the community. Programs on the Psychiatric Rehabilitation Service encourage long-term psychiatric patients to learn to feel more involved with life in general and to perceive themselves and their environment more realistically. Through contingency management, individual, group, and family therapy, off-ward structured activities, milieu therapy, and community involvement, we attempt to increase feelings of self-esteem, skills of caring for personal needs, problem-solving and decision-making skills, and general enjoyment of living. Field trips help patients learn more adaptive ways of dealing with anger and frustration, and are especially important in preparation for living in the community. The medical service is structured something like a small medical ward and offers treatment for patients with significant medical problems. The Extended Care Service provides care for psychiatric patients who are physically unable to care for themselves. The hospital also has its own pharmacy, laboratory, X-ray, dental, and physical therapy facilities. The successful operation of these treatment services depends on qualified staff from all the different clinical and administrative departments. To help achieve our overall goal of maintaining a sound treatment program, every hospital employee is encouraged to participate in relevant educational activities. The Staff Development and Training Department conducts programs designed to meet the specific educational needs of the staff. The Resource Library and audiovisual materials also play an important role in the staff development process. Now that you have a better understanding of our program, let's take a look at a hypothetical patient named Deborah. 4 weeks ago, she was referred for admission by her local comprehensive care center. After she became withdrawn, began hearing threatening voices, and felt that her drinking water was being poisoned by neighbors. Her family contacted the comprehensive care center, who talked with Deborah recommended hospitalization, and assisted her in obtaining an appointment for a pre-admission evaluation at the hospital. Let's follow her through the course of treatment on the intensive treatment service. Deborah and her family arrive at the hospital and are directed to the admission office. There they are interviewed by a social worker to obtain psychosocial information that is necessary for a better understanding of the nature of her problem. She is then interviewed by the admission psychiatrist, who encourages her to talk about the problems she has been experiencing recently. Deborah and the doctor decide that hospitalization would be beneficial to her, and Deborah agrees to voluntarily admit herself to the hospital. During this admission process, she is given a physical examination, given information concerning the hospital, and is made aware of her legal rights while a patient. Patients retain most of their legal rights and civil liberties while they are in the hospital. Among these rights are the right to vote, the right to humane care, and to treatment that can reasonably be expected to help the patient improve, the right to have visitors, to receive and send mail, the right to refuse treatment, and when the patient is a voluntary admission, the right to leave the hospital upon request. After her valuables are taken to the business office for safekeeping and her clothes are labeled for identification. On the ward, Deborah is greeted by a nurse and health aides who tell her about the ward routines and introduce her to other staff members and patients. The nurse and Deborah begin to complete the psychiatric nursing care plan, which will assist the treatment team in her ward. Members of the team include a psychiatrist, registered nurse, licensed practical nurse, health aides, social worker, psychologist, and may also include representatives from vocational rehabilitation, occupational, recreational, and music therapies. They review her history and current condition and discuss with Deborah. The initial treatment plan is developed by Deborah and the staff so that the most efficient and beneficial modes of treatment can be used to meet her current needs. These modes may include medication, activity therapies, group therapy, and rehabilitation services. Deborah's psychiatrist thinks that she can benefit from medication. Other members of the treatment team think that she can also benefit from occupational, group, recreational, and music therapies. Soon after her admission, Deborah is seen by a parapsychiatric evaluation team, which consists of representatives from the various parapsychiatric departments: music, occupational, physical, and recreational therapies. The team is designed to give Deborah the opportunity to be involved in her activity planning and to determine which activities are best suited for her needs. Deborah participates in a name game activity with the staff and other patients to test her memory and degree of social interaction. She then does some simple exercises and movement activities. These activities, the staff is evaluating her balance, coordination, ability to follow instructions, and reality orientation. All of this information is then used to develop an activity schedule that is returned to the treatment team for their review and approval. Since Deborah is felt to be a responsible person and to eat her meals in the dining room, she can also spend some of her leisure time off the ward purchasing snacks in the canteen, playing pool in the recreation hall, or listening to records in the music room. When she's not involved in scheduled activities, she can also spend time on the ward area. Because Deborah has been withdrawn, nursing staff encourage her to interact with others. A typical day in Deborah's treatment program begins at 9 a.m. with group therapy. Here she is working on improving her communication skills and learning to develop trust in others. She is exploring with learning to meet her needs in the hospital, as well as to identify needs that she will have when she returns to the community. Later in the morning, in recreational therapy, she is involved in planned activities which give her an opportunity for success and recognition, and to help her develop social skills and develop better coordination. Patients who have off-ground privileges may attend recreational activities such as bowling, swimming, and sports events in Lexington. After lunch, while working in a group setting in the occupational therapy clinic, Deborah is gradually developing awareness and trust of habits and a sense of personal responsibility. She is learning ceramics as a hobby which she can continue after she leaves the hospital. Other patients in her group are developing activities of daily living, while some patients receive treatment from the physical therapist. Deborah's progress is reviewed weekly by the treatment team, and her treatment program is adjusted to meet her changing needs. After 2 weeks, she no longer hears threatening voices or thinks that her water is being poisoned. Her social worker, who is also Deborah's treatment coordinator, feels that she is developing self-confidence and beginning to redevelop work habits and responsibility. Deborah discusses with her social worker the Assembly Line Project's work program and the Greenhouse Project. Deborah decides that she would benefit from working at the greenhouse, and the treatment team agrees. She is discontinued from occupational and music therapies and instead works each afternoon in the greenhouse. We have 2 full-scale greenhouses where patients are responsible for the seeding, potting, and selling of house and garden plants. In the summer, a 3-acre garden is also maintained. The produce, such as tomatoes, corn, potatoes, and apples, is sold to employees and to the public. Patients working in this project are paid an hourly wage according to the difficulty of their job and the degree of responsibility. Deborah continues group therapy and participates in evening and weekend recreational activities. She begins individual counseling with a psychologist 3 days a week and has started to attend church services led by a hospital chaplain. Deborah continues to steadily improve and starts thinking of returning home. She talks with her social worker about her fears of how she will be received at home and her need for assistance in finding a new job. During one of the family visits, the social worker has a conference with Deborah's family to discuss their expectations of her when she returns home. Deborah also talks with a vocational rehabilitation counselor who makes an appointment for Deborah to see a counselor in her home community who will help her to find a job when she leaves the hospital. The social worker discusses the discharge plans with the treatment team, and they agree that Deborah is ready for discharge and can leave the hospital at the end of the week. On Friday, the psychiatrist writes Deborah's discharge orders, which include a prescription for medication to take home with her. Deborah and her social worker discuss the importance of her receiving follow-up treatment from her local comprehensive care center and make an appointment for Deborah to see her outpatient therapist within a few days after discharge. Deborah signs the necessary discharge papers, and the transportation department takes her to her local comprehensive care center where she meets her family. In following Deborah through her course of treatment, we have seen how the services offered by the hospital can be used to quickly return a patient to the community. Although Deborah had a home and a family to whom she could return, many patients do not have these resources and need more assistance from hospital staff and community agencies to find suitable living situations before leaving the hospital. Over 60% of the persons discharged from the hospital are able to return to their own home or to the home of a family member. Others, however, need a more structured or supportive setting. Some go to personal care homes, group homes, skilled nursing facilities, halfway houses, or to other institutions. A psychiatric facility such as Eastern State Hospital can serve only immediate needs. In order to fully meet the needs of persons with psychiatric problems, effective community resources are essential. It is vital that the community and the people in the community provide an environment that will help a person lead a productive and rewarding life.